Hello, everyone. We'll get started in just a minute. Feel free to introduce yourself in the chat, where you're coming from, what brought you here tonight. It's great to see you all. Hello, everyone. We'll get started in just a minute. Feel free to introduce yourself in the chat. It's great to see you all tonight. Okay, welcome everyone to Epidemics of Injustice. This is our final session of the semester's weekly course activities, and we're really excited tonight to have Dr. Camara Jones, who will introduce in just a minute. Feel free to keep introducing yourself in the chat. We love to hear where people are coming from. I know we've had people from all over the country and even internationally come to these sessions, so I'm really excited to see you all tonight, and I look forward to our discussion. We do have closed captioning available tonight, so if you would like to take advantage of that option at the bottom of your screen, you'll see an option to enable captions. So if that's something you would like, feel free to do that. So thank you to Tina, who's our captioner. So a little bit about Epidemics of Injustice before we get started. This is an annual course that is free and open to the public that is aimed to prepare public health leaders and community members with the tools to bring about social change to address the structural determinants of health. Each year we have a different theme, and this year's theme is resistance, rebellion, and revolution through public health. And we've been doing everything virtually this semester, and we've had our sessions going from 5:30 to 7. Unfortunately, this is the final one, but if you were not able to join us for previous sessions, all of those are recorded and available on the School Public Health's website, and we can drop the link to that in the chat if that's something you would like to check out. And tonight's session is also being recorded, so if you would like to share it in the future, the link to that will be sent out to all attendees either tomorrow or Monday. This course is also, for the first year, sponsored by the Collaboratory for Health Justice at the USC School of Public Health, and we look forward to the course being kind of under this umbrella in the future. A little bit more on the background of this course. It was actually started by a group of students under the organization Radical Public Health, which is an association of students, alumni, faculty, and staff, and also community members who seek to address the systemic and underlying causes of public health challenges and consider more radical solutions. So this year, our PH has a number of different committees, including the Epidemics of Injustice Committee, Abolition Committee, COVID-19, and Outreach Committee. And so they do meet regularly, and the next meeting is May 6th at 7:30. So if you are interested in participating with Radical Public Health, we have the email here on the slide, rph.uic@gmail.com. And you can be added to the listserv and get updates on future events, including next year's Epidemics of Injustice course. Before we get started tonight, I also want to acknowledge that the University of Illinois Chicago resides on the traditional territories of the Three Fires people, the Ojibwe, Ottawa, and Potawatomi. And by making this land acknowledgement, we recognize that Indigenous peoples are the traditional stewards of the land that we now occupy, and those who were here long before Chicago was a city, and they're still thriving here today. Lastly, if you do enjoy this session, we really enjoy making this open and available to as many people as possible. And so the Collaboratory for Health Justice does have a donation fund specifically for this course and supporting its accessibility and availability in the future. With that, I will pass it over to my co-instructor, Ms. Washika Torres, to introduce tonight's speaker.
Hello, everyone. This is Ms. Torres, and I just want to share everyone's excitement and elation at having Dr. Jones speak with us tonight. So, Camara Phyllis Jones, MD, MPH, and PhD, is a family physician, epidemiologist, and past president of the American Public Health Association, whose work focuses on naming, measuring, and addressing the impacts of racism on the health and well-being of our nation and the world. Dr. Jones is currently a presidential visiting fellow at the Yale School of Medicine in the Department of Medicine and the Office of Health Equity Research. Dr. Jones will serve as the 2021-2022 UCSF Presidential Chair at the University of California, San Francisco, and was also the 2019 to 2020 Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Study at Harvard University. She taught 6 years as an assistant professor at the Harvard School of Public Health from 1994 to the year 2000. She served 14 years as a medical officer at the Centers for Disease Control and Prevention, so from 2000 to 2014, and is currently an adjunct associate professor at the Morehouse School of Medicine and an adjunct professor at the Rollins School of Public Health at Emory University. Dr. Jones's allegories on race and racism illuminate topics that are otherwise difficult for many Americans to understand or discuss. Recognizing that racism saps the strength of the whole the whole society through the waste of human resources, she aims to mobilize and engage all Americans in a national campaign against racism. So please welcome me in welcoming Dr. Camara Jones.
Thank you, Washika. Thank you, Alexis. And thank you to my colleagues, Dr. Dick David and Dr. Linda Ray Murray, who have established this course. This is such an amazing opportunity for all of us to be learning together. So I'm happy to be here. I am going to share my screen. Now, let me tell you that I have a lot of different ideas that I am happy to share with this assembly, but I want you to interrupt me at any time. If we were in public, I would say, raise your hand. I will finish my sentence, and then I'll get your question, your comment, your challenge, your amen, whatever. So we want to do that even though it's virtual world. So if you put something in the chat, I know that there's at least one person monitoring the chat, and I've given folks the permission as they're monitoring the chat to say, well, Dr. Jones, we have a question. Do you want to take it now? So that's how we're going to operate. I may or may not get through all of the slides that I've brought here to share, but what we really want to have is a robust sharing in community. I've entitled the scope of our sharing, Social Change in Practice, Crisis at the Nexus of Racism and COVID-19, Dual Pandemics, if you will. So I'm going to start by just saying that 5 years ago, when I was president of the American Public Health Association in 2016, at that time, I took full advantage of having a platform to launch our association and as many other associations, communities, organizations as would join us on a national campaign against racism with 3 tasks. The first being to name racism, to say the whole word racism, because in our national context of widespread racism denial, if you don't say the word racism, you're complicit with that denial. And we got to name a thing before we can start addressing that thing. So naming racism is step number 1 of the 3, but it's not the end all and be all, because then we need to ask the question, how is racism operating here and now, so that we can identify levers for intervention, targets for action. And then once we have identified those targets, we need to organize and strategize to act, because none of us alone is going to tear down this whole or dismantle this whole system. But I do believe that each of us taking a little bit of a part and organizing and strategizing in collective action, that we can dismantle this system and put in its place a system in which all people can know and develop to their full potentials. So that's the importance of collective action. Now, I would take the teeniest, tiniest little bit of almost credit for the first of what are now at least 183 declarations across the United States that racism is a public health crisis, because in 2018, Lillian Payne wrote with others on behalf of the Wisconsin Public Health Association, a declaration that racism is a public health crisis that then in May of 2019, Milwaukee County adopted. So that was the first of now 33 states with some at least one city or county, or sometimes at the state level, these declarations. So I just make kind of a time lapse so that you can see how ideas spread. And it's slow at first from, Wisconsin, but look what happens in May after we recognize the disproportionate impact of COVID. And then look what happens in June after the murder of Mr. George Floyd. And then more and more states still are being added to this number, where at least one city or county, or maybe a state legislative statement or a governor's statement, there are 8 states that have done something at the state level, have made these declarations that racism is a public health crisis. And many of you may know that 3 weeks ago, Dr. Rochelle Walensky, who is the director of the Centers for Disease Control and Prevention, asserted that racism is how does she say it? It's a serious threat to public health. So there are more and more people piling in. So I think this is amazing. Naming racism, putting a stake in the sand, saying people who, whom we serve at the city or county or state level, please hold us accountable for naming racism, but then, and doing what? So there are 2 parts to it, naming racism, moving to action. Even at the part of naming racism, we all need to be clear. There are 4 key messages that we need to communicate. The first being that racism exists, because there are many people who are still arguing that point. The second being that racism is a system, so that when we say the word racism, or when we're talking about racism or trying to engage people in anti-racism action, we have to talk about it as a system. We're not trying to divide the room into who's racist and who's not, or peer deeply into anyone's soul to say exactly how racist are you, right? The third of these 4 key messages is that racism saps the strength of the whole society. And the fourth of the key messages is that, yes, we can act to dismantle racism. So I want to share with you today, I'm basically just going to share one of my allegories and allude to a few of the others. No, maybe I think I'm going to share 2 allegories if we have time, and allude to a third and just kind of skip on a fourth. But this allegory that I call Dual Reality, a Restaurant Saga, is the one I whip out of my pocket if I only have 4 or 5 minutes to talk to a group of people to convey the message that yes, racism exists. Even if your whole life experience has been that, oh, this isn't, a land of equal opportunity. So this allegory was sparked by my experience as a first-year medical student. So here I am, okay, come with me in my story. One Saturday, as I did on most Saturdays, I had awakened early, I was studying, it was mid-afternoon, I was still studying, nose in the books. Some friends come over. Do they interrupt me from my studies? Oh no, we all get to studying long and hard, and now it's getting late and we are getting hungry and I have no food in the apartment, which was so typical of me that my friends said, okay, Camara, we got this. But you know what, Camara, even though you don't have food, we're hungry. Let's go into town and find something to eat. So we do. We walk into town and we find a restaurant and we walk in and we sit down. And the menus are presented and we order our food and the food is served and here we are eating. So perhaps not the story about racism and a restaurant that you thought I was going to tell, but hold on. As I sat there eating with my friends, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now maybe I've intrigued you. And so now you're like, okay, Dr. Jones, what did the sign say? Well, what did the sign say? The sign said open. So now maybe I've lost some of you. So let me recap. Here we are, sitting in a restaurant eating. I look across the room, I see a sign that says open, thinking no more about it. I would assume that other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that now indeed the restaurant was closed due to the hour, but firmly closed. And that other hungry people just a few feet away from me, but on the other side of that sign, would not be able to come in, sit down, order their food and eat. And that's when I recognized that racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on, because it is difficult for any of us to recognize a system of inequity that privileges us. So, for example, it's difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for all Americans to recognize our American privilege in the global context, although we should be feeling a little uncomfortable about that right now because of how we have sucked up so much of the global vaccine supply. Now, those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So, back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't even compel you to act, but it does equip you to act, so that if you care about those on the other side of the sign, which is an if, but if you do, well, you could even talk to the restaurant owner, who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door, let them come in? You'll make more money. And oh, the conversations we could have. Or maybe what you'll do is pass food through the window. Or maybe you'll try to tear down that sign or break through the door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So when I have just a few minutes, as I said, to convey to a group of people that racism exists, it's structuring two-sided or multi-sided signs in our society. It's creating a dual or multifaceted reality. Actually, I once started a 3-hour conversation with this following question. How could people who are born inside the restaurant know something about the two-sided nature of that sign? And it was a 3-hour conversation because there are many, many ways to know. I have to say that these days I'm heartened that more people who are born inside the restaurant have gotten a little sense of the two-sided nature of the sign. More people who just a year ago may have been sitting inside the restaurant and saying, well, what are those people saying outside? Black Lives Matter? Don't they know all lives matter? Are now affirming, yes, Black Lives Matter. More people born inside the restaurant are saying the word racism, or even putting together the word structural racism or systemic racism. This is good. There are 183 and counting. That was just a month and a half ago, last time I looked. 183 jurisdictions that have made formal declarations that racism is a public health crisis. This is important. Here is my warning. If we just say a thing, make a declaration, write a statement, put it on our website, in about 6 months, we may forget why we said that thing, because racism denial is so staunchly held in this nation, and it's so seductive that in 6 months, we may fall back into what I describe as the sleepiness, the somnolence of racism denial. So we have to go beyond saying a thing to acting. So we need to be tearing down the sign. And of course, racism is not just a sign, it's a door, it's a lock. There's a whole system going on. So we need to dismantle the lock, take the door off the hinges. We must start acting, because if we start acting, we will not forget why we are acting. So now I owe all of us, well, I wonder, are there any questions or comments up to this point? I'm not trying to stop my flow, but if there are there? No?
There is nothing in the chat right now.
That's all good. That's all good. When they start flowing, then you interrupt me. Okay. So now I know that I owe all of us a definition of racism. Remember now, I've already talked about 4 key messages. Racism exists, racism is a system, racism saps the strength of the whole society, and that we can act to dismantle racism. Well, 2 of these things are squarely in my definition of racism. So when I say the word racism, I'm clear. that I'm talking about a system. I am not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested. But I am talking about a system of power. Now, it can manifest in those ways, don't get me wrong. But in its essence, racism is a system of power, and a system of doing what? A system of doing two things: of structuring opportunity and of assigning value. And on what basis is the opportunity structured, and on what basis is the value assigned? It's based on the social interpretation of how one looks, which is what we call race in this country. So for everybody listening, we need to be clear that race is not biology. Race is not even capturing, culture, right? Because within any so-called racial group, there are many, many cultural, ethnic groups, language, histories, all kinds of things. Race is not social class, although in this country, because of racism, which I can go into a little more detail later, because it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That's not just a happenstance. It's the result of initial historical injustices that are perpetuated by present day contemporary structural factors, which are part and parcel of what I used to call institutionalized racism, which we now would talk about as systemic or structural racism, right? So it's none of those things. All race is the social interpretation of how one looks in our race-conscious society. And that same race that a medical admitting clerk might check off for me if I get into an emergency department and can't talk, that same race is the same race a police officer notices, or a judge in a courtroom, a teacher in a classroom, a taxi driver. And it is that socially assigned race, without the benefit of even me asking you on the street, excuse me, how do you self-identify? Or excuse me, where were you born? Where were your parents born? Or excuse me, may I have a little aliquot of your blood? I have a genetic hypothesis. Race is none of those things. Race is the social interpretation of how one looks in our race-conscious society, and it is the substrate on which racism has operated for centuries and continues to operate today in order to structure opportunity and assign value. Now, what are the impacts of this system of structuring opportunity and assigning value based on so-called race? Well, when we do recognize that racism exists in this country, then we usually get to the fact that racism is unfairly disadvantaging some individuals and communities. But it shouldn't take us long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about in this country, because it makes some people, especially some people who are living as white, uncomfortable. I have to say, during my many years, decades of doing this kind of work and talking about these things, there have been times in the past when I'd be in a room and I feel people kind of, start shifting when I talk about unearned white privilege. And I would even say, well, I'm not trying to make anybody uncomfortable. If you feel uncomfortable, shake it off. Stay with me. I'll tell you more stories. I do not apologize in that way anymore. Oh, no. What I say, I acknowledge that understanding that racism unfairly advantages some, talking about unearned white privilege in this country can make people uncomfortable. But what I say is, if you feel uncomfortable, I encourage you to lean into that discomfort, because I have come to recognize that for each of us, the edge of our comfort is actually our growing edge. But there's a third impact of racism that many of us miss, and that is that racism saps the strength of the whole society through the waste of human resources. So, for example, it's not just that Black lives matter, for example, it's that Black lives are precious, their genius, their leadership, their generosity and creativity and love. And when we constrain Black lives, and when we constrain Latino or Hispanic, brown lives, when we constrain Indigenous or red lives, when we constrain Asian lives, when we constrain Native Hawaiian or other Pacific Islander lives, when we constrain any of these racialized lives, either slowly by not vigorously investing in the full excellent public education of all of our children, because the blinders of racism have made some people think that there's no genius in the barrios or the ghettos or on the reservations. We can get along very well, thank you, without those kids, when of course there is genius in all of our communities. And if we were only to vigorously invest in that genius, we could be doing so much better as a nation or even as a world. Or if we constrain these Black and Indigenous and other people of color lives slowly by being complacent, with the wholesale warehousing disproportionately of so many Black and brown men and women in our prison system, as if that didn't separate us from human potential. Or if we off these lives in an instant in a barrage of police bullets or with a police officer's knee, we need to understand that that does not just represent a loss of that individual genius to a family or to a community. It represents a sapping of the strength of the whole society through the waste of human resources. And of the three impacts of racism that I have lifted up right now, I actually believe that that third one, how racism saps the strength of all of us, is the one that we need more media attention on right now. It's the one that we need more data collection on, that we need more conversations around our dinner tables or board tables or our community tables, so that we have more people filled with a sense of urgency to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. That's a long time on that slide. Sometimes I just can read it, and sometimes I feel like I'm in the spirit right now going deep. So, so you guys might have to say, okay, Dr. Jones, let's keep moving. But anyway, so now I know that people in the class have read my Gardener's Tale allegory, and many other people, if you're from the community, may have not. I do not have time to do justice to my Gardener's Tale allegory. I will say that it illustrates three levels of racism. One that I used to call institutionalized, and I would call systemic or structural. The second that I call personally mediated, even though other people call it interpersonal, because I am so clear that racism is a system, and that level is the system mediated through people. And a third that I describe as internalized, both from the point of view of stigmatized races and elevated races. And the story is to illustrate these three levels of racism and to strongly affirm that if we're going to set things right in the garden, we need to at least address the structural, systemic, institutionalized racism. So I thought I might tell the story. If somebody really, really wants to hear the story, then I might could do a quick version. But I do want to say that at the end of the story, where I have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, and one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some is going to produce pink blossoms, some's going to produce red blossoms, and the gardener prefers red over pink and puts the red seed in the rich, fertile soil, pink seed in the poor, rocky soil, and things ensue from there. I often end my discussion of that story with who is the gardener, because in the story, the gardener is the one that I have given the power to decide, the power to act, and control of resources, which are actually the elements of self-determination. And in our US context, clearly government is a huge part of the gardener, but not the only part. So media, corporations, foundations, health systems, communities, to the extent they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red. That's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. And then I raised the question, what do we have to do about the gardener? Do we make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? So many questions that can come out of this story. And so for those of you who've read this story, the next few things are going to make sense. And for the others, I'm sorry, but you can Google Camara Jones Gardener's Tale and you can have me, get an 18-minute video of me telling that, or you can read my 4-page paper that's there at the bottom of the slide. But what I want to say here is two questions that have been asked of me that I want to lift up. I was once asked, excuse me, Dr. Jones, why should the red flowers share their soil? And I loved that question when I heard the question, because it showed me the power of this story to start conversations about racism, which might be otherwise difficult if we were talking about racism between you and me. But my answer to that question is why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers, it belongs to the whole garden. But here's a second question. What if that's not the original gardener we're looking at? What if that's the gardener's great-great-great-great-grandchild? Here we are. And that great-great-great-great-grandchild has always seen the flowers looking like that, may not even think there's a problem to be solved. And so very quickly in 3 steps, the first thing is we must make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution, right? Put it on our action agenda. The second is, as we try to solve that problem, we must make the flower boxes transparent. We must be talking about the differences in the quality of the soil. But the third thing is, as we make those flower boxes transparent, we also need to make it clear to everyone that the pink seed did not just go launch themselves into that poor rocky soil. So we must talk about the gardeners. Well, first of all, we need to read and acknowledge history, and then we need to talk about the gardeners' initial preference for red over pink that set up the whole situation. And in our context, that initial preference for red over pink, people would call that cultural racism. In our context, it's clearly white supremacist ideology. And so we must address that preference for red over pink, even as we are compelling, if we are able to, the red gardener to enrich the poor rocky soil until it's as rich as the rich fertile soil. Because even if we were to compel her to do that today, if she were to today enrich the poor rocky soil until it was as rich as the rich fertile soil, if she continues to prefer red over pink, she'll continue to privilege red over pink going forward. So this story, which used to just be about the quality of the soil, you know, and the flower boxes keeping the soil separate and all of that, inaction in the face of need, I actually, in my telling of the story over the years, had to acknowledge that the structural piece is important, but we also have to deal with the values piece. Racism is a system of doing two things: structuring opportunity and assigning value. And if we don't deal with both of those, we will not set things right in this garden. So for those of you who understood the story, good. For those, I didn't have time to do the whole thing because I have so many other things I want to share, including my newest allegory.
So before we go to
Yes.
the next allegory, we did have a student who had a question about the first one. So, and I thought this was really interesting. So it says, when you ask the restaurant to let people come inside to eat, it means the workers have to stay late. I wonder if they represent anyone in our society in this allegory.
So the allegory is about access to opportunity, and hopefully, and you're right that the workers in the allegory are invisibilized in my story, although many of the people who can't come in to eat are also coming in the back and bringing in the food and cooking the food and all. And the people who are sitting inside the restaurant don't even know who those people are, that they're benefiting from their labor, nor do they miss having them sit next to them to eat, because the people inside the restaurant are so happy to be there and so full of their food and so feeling that they're not missing anything around their table, you know, that they don't even look up to wonder where are the other people. So when I talk about I'm talking about opening opportunity. Clearly, that means that there's going to be more required of everybody. And so maybe some of those people who've just been sitting will need to go back in the kitchen and work or go grow some of the food and the like, but at least everybody will have an opportunity to eat. So that's how I've been thinking about it. And you're right that I did not lift up the workers in the restaurant because the image was one of we live such a divided life in this society. There are people who really do not know that just across town, there are people just as kind, funny, generous, hardworking, smart as they are, who are living in very different circumstances. There are some people who are living in beautiful homes and beautiful neighborhoods and, you know, have everything that they need, who still feel needy because they don't understand the real need on the other side of town. So this open, closed image is less about imposing more work on people and more about recognizing the dual reality that you can be feet away from somebody else who is living a very different life. What we have seen right now in police response to feelings of threat is that if it's a white person, they don't feel threatened. Even if there was a video that I saw, I don't know from how long ago, but of a young white man who actually tussled with police officers, pulled one of the guns, shot it, and he's still alive. He got like probation and something and a bruise on his head because the more police officers came in to tussle with him, they did not shoot him. But you can be Laquan McDonald walking away from a car, nothing in your hand, no threat to anybody, shot 16 times in the back. So many Black men shot in the back, not a threat at all. And yet white men clearly threatened, or white like Rittenhouse or whatever, you know, who killed people and then walking with his big assault rifle down the street, hands up, thinking the police are going to stop him, and they give him water or whatever it is. The one who killed the 9 in oh my God, South Carolina. Oh my God, Charleston, at Mother Emanuel Church. When the police came, they knew he had killed 9 people. They usher him gently into a police car, think he looks hungry, and take him to Burger King before they take him to the station. But the people who are living that life in which they get the benefit of the doubt, high expectations, safety, when other people in much less dangerous, should have been situations are killed, there are some people who don't even understand the reality of others because they think that their reality, where things scream open, is the only reality. They do not understand the duality, the two-sided nature of the sign. But those on the close side clearly understand it because they can see all this other stuff going on. The people inside aren't even looking out or looking around. They are happy where they are. So that's what this story is about. But thank you for inviting me. I mean, clearly, as more people are eating, more people are going to need to work as well. And it's going to be everybody's work. Thank you for the question. Anybody else? Okay, so we'll keep on. I loved that question, as you can see. I hope I talked slowly enough for the transcription people and translation people to get it. So now this allegory is my newest one, so it's not really polished, shiny, clean, but I do have some illustrations for it. And this one is to talk about the importance of us understanding and addressing racism as a system. So I call this one Cement Dust in Our Lungs. And in this allegory, all of this is about racism. So the cement dust is about racism, the cement dust in our lungs is about racism, the factory is about racism. All of this is about racism. So imagine that there's a cement factory spewing cement dust. And there's so much dust in the air that if you're anywhere around this factory for any amount of time, you're going to develop cement dust in your lungs. All of us. Now, the cement dust in my lungs might affect me differently from cement dust in somebody else's lungs. Cement dust in my lungs might make me feel like I'm less than. Maybe I shouldn't try to graduate from high school, right? Cement dust in somebody else's lungs might make him feel that with impunity, he can crush the life out of another human being with his knee for 9 minutes and 29 seconds. But whatever, we start to recognize that the cement dust in our lungs can be problematic. Some of us do. Some of us deny that there's cement dust in our lungs, and they don't even want to talk about cement dust in case you want to look at them. But the question is, what are we going to do? This is a problem. So are we going to focus on the individual in understanding and addressing this problem of cement dust in our lungs? Are we going to create some kind of screening machine that's going to look at people and then, ooh, if they find too much cement dust in your lungs, a little alarm goes off? Well, people are afraid of that. The people who don't want to talk about racism, the dust in our lungs and all around, they're afraid of that because that's why they don't want to talk about racism. They think when you say the word racism, you're calling them racist. I actually don't think that that's the best way to approach it, like focusing on the individual and putting alarms. There are people, all of us have different kinds of effects from cement dust in our lungs, right? But maybe another individual approach would be to set up some kind of cleansing spa. So people who want to address the cement dust in their lungs can go to the cleansing spa and they can go on in and do their training or whatever and come out good as new. But if they come out into that same cloud, then the cement dust is going to reaccumulate in their lungs. And people who have looked at the effects of trainings and implicit bias stuff and all like that recognize that there's small effects, but we have to do something more. So, okay, so maybe not at the individual level. So maybe we need to focus on the cloud, the climate, white supremacist culture, maybe we need to focus on that. So at least if we are acknowledging this cloud, then we're understanding that we weren't born with cement dust in our lungs, that it's coming from somewhere. And if we understand that and we don't want more cement dust in our lungs, then maybe we'll decide to put on a gas mask, right? Recognizing the gas mask is going to keep more of the dust accumulating in our lungs, although it doesn't necessarily extract the dust that's already there. But there's something good about that because wearing my gas mask, every time I see myself reflected in a mirror or in a glass, then I'm going to be reminded I'm surrounded by racism all around me. The cement dust is all around me. And it might be beneficial because when you see me, you can ask, Dr. Jones, why are you wearing a gas mask? And I'll say, there's cement dust in the air. And so then more and more of us will put on gas masks. But is that the answer? Do we need to just have everybody wear gas masks and make little baby gas masks and old people gas masks and the like? I think that is insufficient. The gas masks represent our individual anti-racism journeys, but I think our individual anti-racism journeys are insufficient. because the dust is still there. So what I do believe we need to do is focus on the factory, focus on the structure, focus on the system, which means especially those of us who have recognized that there's cement dust in the air, we need to move to action. And the factory is hard to see with all the dust, but we need to start looking for this factory. We need to ask the question, how is racism operating here? And I'm going to talk in more depth about that question in a minute. And then we need to organize and strategize to act to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. So you see what I'm saying is that if we really want to set things right, we need to understand that racism is a system. It's a cement factory spewing cement dust, and it doesn't just so happen that people are acting out of cement dust in their lungs, and it doesn't just so happen that there's a whole cloud of cement dust that we're living in. There is a factory, that racism is not a cloud or a miasma. It is a system with identifiable and addressable mechanisms, which takes us to the next part of my talk, which is to ask the question, how is racism operating here? That is a legitimate question when you're dealing with a system with addressable, identifiable, and addressable mechanisms, which are in our structures, policies, practices, norms, and values, which are actually the elements of decision-making. So what do I mean by that? Well, the structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And every time any of you going forward finds yourself at a decision-making table or is setting a decision-making table, I charge you to look around and say, well, who is not here at this table who has an interest in this proceeding? And then your job is not just to represent their interests, the missings, right? Not just represent their interests, although you might have to do that in the short run, but what your job really is to create space, to find them a way to the table. And if structures are the who, what, when, and where of decision-making, who's at the table, who's not, what's on the agenda, what's not, policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and they're a little harder to get a handle on, and values are the why. Now, this question, how is racism operating here, I encourage you to take with you everywhere. I find it a very useful question. When people ask me to talk, on children and nature, then I spend 10, 15 minutes thinking, well, how is racism operating here about children of color not getting more, as much access to white children to nature? Or when you think about representation on clinical trials of people of color, or when you think about anything, police killings of unarmed Black and brown men and women, how is racism operating here? I can take this question and I can generate in 10 or 15 minutes, 5 to 15, 20 early targets for action, levers for intervention. So I'm just going to give you an example of that. And that is, first of all, I'm going to just kind of describe what's going on with regard to excess deaths of people of color from COVID-19. And then I'm going to ask the question, how is racism operating here? And just quickly give you an example of how we can think about this. So with regard to people of color and COVID-19, we are more likely to become infected because we're more exposed and less protected. And once infected, we're more likely to die because we're more burdened by chronic diseases with less access to healthcare. So first, we're clear that there is nothing biological, going on because of so-called race, right? And it doesn't just so happen that we're more exposed and less protected, or that we're more burdened by chronic diseases with less access to healthcare. That's when we ask the question, how is racism operating here? Where the structures, the who, what, when, and where of decision-making have resulted in residential segregation, coupled with disinvestment that has resulted in us being more exposed in our frontline jobs or in crowded housing, and it has resulted in us being more burdened by chronic diseases because of limited food options, poisoned environments, and the like. The policies that limited personal protective equipment for low-wage essential workers, and the same policies about the vaccine rollout, which are also limiting our access, has made us less protected. When you have, in the early parts of the rollout, pharmacies as one of the ways, or stadiums way out some kind of place, not recognizing pharmacy deserts or the difficulties in terms of transportation, or even having online registration for appointments when people may not have a computer or broadband or time to do that. So those policies. Practices like the locations at first of testing centers and now vaccination sites in affluent areas has led to less access to healthcare, besides all of the other limits to access to healthcare that we've experienced, in terms of financial access, but location, physical access and linguistic access. So those practices. The norms, the underlying racism denial that's so staunchly held in our nation and is so seductive, has actually led to this vaccine hesitancy thing as victim blaming, I believe, because yes, many people in many populations, especially at the beginning, were like, well, I think I'm going to wait and see for a while. But even in the first Kaiser Family Foundation survey that I saw that said that 35% of Black folks said they were going to wait for a while, in that exact same survey, 42% of people in rural areas and 42% of Republicans had the same thing. But there was this focus on vaccine hesitancy in Black and Brown communities and Indigenous communities in a way that, recognizing the historical insults to us over time by the healthcare system and medical system and experimentation and all that, yeah, that's for real. But in a way that then seemed to blame the fact that not only, if this is our representation of the population, not only were we being infected more and dying more, but seemed to blame us for using vaccine hesitancy for why we were immunized less. And that really is about ensuring access and providing resources according to need. And finally, you see, I'm talking deeply into the slides when I should have just read everything. But anyway, values. So white supremacist ideology, this notion of a hierarchy of human valuation by race with white people at the top as the ideal or the norm, actually has led to inaction in the face of need, indifference, and normalization of so many things in our nation. Structural racism very often shows up as lack of action, inaction in the face of need, because people are blaming other things. They don't even recognize the need. And this normalization of the racial, ethnic disparities in infection rates and death rates, hospitalization rates and death rates of people of color compared to white people in this country is the same normalization. That's not the story anymore, right? That's not the news it was in April of 2020. It's the same normalization we've done for the differences in the numbers of our babies dying before their first birthday by race, or the numbers of our mothers dying in pregnancy or in childbirth or within a year of childbirth, the maternal mortality rates and the like. So,
Dr.
any
Jones,
questions?
we actually have good
Yes, okay, any questions?
stopping point. We do have a question that was put in the chat earlier by Kimberly Neff. Recent estimates have indicated STIs, like many health disparities, impact Black women disproportionately. Nearly half Black women in the US have genital herpes. What can be done to support these women to prevent this trend from continuing? And you might answer this later.
Well, so thank you for the question. I am surprised at that statistic. I don't know, you're saying that's true. I'm surprised at that statistic, and I don't know how that compares to other women with genital herpes. But what we need to do as a health system is to monitor things. I'll get to that in the end, but we need to look at differences not only in outcomes by race or gender or immigration status or language or ethnicity or zip code, that kind of thing. We need to actively look for evidence of two-sided signs, for evidence of differences in outcomes, as well as differences in opportunities. When we find the differences in outcomes, what we need to do is ask serial whys. We need to say, well, why is that? And then why is that explanation? And then why is that? And that's how we go from an individual explanation to understanding root causes. So although I did not know that statistic, and I do not know the whys, it is incumbent on us not to just document these differences, but to vigorously try to understand the root causes of the differences. And when we do that, that's how we will get to the answers to address it. And so even when we're actively looking for evidence of two-sided signs, is there something differential? It looks open on one side, closed on the other. Is there something differential going on here by race that we then need to not just document those things? We need to go beyond the outcomes to the opportunity structures and the like that have led to that. That's my quick answer. Anything else?
So we had another question from a student, from someone, Sherry Smith. And she writes, I've recently been hearing of increased interest in medical fields to screen children, adolescents, and families about racism and other forms of bias and discrimination. She was interested in knowing your thoughts, especially in connection to the notions of like screening that you mentioned in the cement allegory.
Right. So I don't know what that kind of, I guess if I were to guess what that screening might be looking at is to ask people about their specific experiences of racism. But many people actually, until you talk to them for a while, may not quickly articulate their individual experiences, but racism is not just experienced individually, it's experienced on communities and in the whole nation. So I think that the point, if we're in a setting that wants to acknowledge racism, is not to screen individuals, but to ask the question, how is racism operating here in our setting? I was pushed by a group with whom I'm working, because I talk about in the Gardener's Tale 3 levels of racism: the systemic, the personally mediated, and the internalized. And they wanted to talk about a 4th level of racism, institutional, not institutionalized, which is a process. That's what I call my system, but institutional. And the insight I had in trying to figure out what we were all talking about together was that if systemic racism is all of that history of the initial separation of the 2 types of seed into the initial separation of the same seed, but producing different flowers into the 2 types of soil, the flower boxes, keeping the soil separate, inaction in the face of need over time. What institutional racism is that systemic racism in a given place and time. And it is the answer to the question, how is racism operating here? So that's the insight I want to give people. We are the Gartner's great-great-great-great-grandchildren. Here we are. And we have the opportunity now to look in our settings to ask the question, how is racism operating here, to start to act? Racism impacts individuals and families and communities and nations and politics and all of that. But it is the system, and we need to ask, how is the system operating here? Dismantle the system, and then we won't have to get fans to blow the smoke, or get face masks to screen the smoke, and we wouldn't have to be screening people. How much cement dust do you have in your lungs, or how crippled are you by the cement dust that's on top of you, weighing you down, right? Now, the people who are not going to be good with that are the people who own the cement factory and who are benefiting from selling that cement and don't care about the cement dust. And they got a lot of cement dust in their lungs, or maybe they have a little extra special chamber, right? But because they don't care, I have to say, because they don't care about the impact, they must have a lot of cement dust in their lungs that's making them not care. They would rather trade off the profit for the cement dust in their lungs. They don't even consider it problematic. And so anyway, I'm taking lots of different strands from the cement factory, but that's what I think. I think that for providers to recognize that racism exists is the greatest gift of connection that a white provider can have for a patient of color, is to acknowledge the 2-sided nature of the sign, to acknowledge there's a 2-sided sign going on. So for a provider to acknowledge the existence of racism is wonderful, but then to grill people about their experiences of racism, maybe you can invite and say, well, what do you think? But I don't know enough about the particulars of what you're describing. So it's important for us to name racism at all levels, but individual screening, the screening has to be of the society.
So we actually had an interesting question just pop up from Linda. And she said that I read a conversation this morning and folks were discussing the idea of removing race as a risk factor from published articles and information that would be disseminated to community stakeholders and instead center racism. And they were curious about what you thought. And we also had another student discuss a similar question on the discussion board this week. So great minds think alike.
So I think that that's important. I think that if people do continue to collect data by race, I think that's important for us to understand, how that helps us understand, is there a 2-sided sign going on in terms of outcomes? But we have to be clear every time we use race, what we think we're measuring with race, and we have to acknowledge that race is the substrate on which racism operates. So, and then actually at the Centers for Disease Control and Prevention, we had an ad hoc measures of racism working group that then we formalized as an official CDC scientific work group, the CDC Racism and Health Work Group. Well, out of that work, and actually I saw that Dr. Wayne Giles is on the call, the Dean of UIC School of Public Health. So hi, Wayne. And so he was the one who encouraged us to develop a module that we called the Reactions to Race module. It's an optional module that was available on the Behavioral Risk Factor Surveillance System, which is a telephone survey done by all of the states in cooperative agreement with CDC and DC and some territories, right? And long story short, these 6 questions that we developed could not be used by states. It was up to them. There were certain questions that were on the core of the module, and then they could, core of the BRFSS, and then they could add other questions. So these questions were piloted in 2002 and then available to all states who wanted to use it from 2004 through 2014. Those 6 questions are a good starting point for questions that could be asked for a general population. There are also questions that were developed by Dr. David Williams, by Dr. Nancy Krieger. There are lots of newer investigators with their questions on racism, questions about racism and maternal mortality by Fleda Mass Jackson. There are a lot of people in this area. So I actually think that the most important thing, I have a paper that I'm going to suggest. This was published in 2001 in the American Journal of Epidemiology by me. And it's called, Race, here it is, Race, Racism, and the Practice of Epidemiology, which talks about how we use race in epidemiologic practice. It's 20 years old now, so people may not even know about this paper who are doing the kind of work now. I wonder if the article that you all saw even referenced that. But I think that it has 8 recommendations for epidemiologists with regard to the use of race in epidemiology, and it's all about centering racism.
Thank you. I've actually read that paper, so I'll find the link and drop it in the chat here. We kind of had a follow-up question from your response. So could you just kind of touch on this idea of removing a race, and is that a form of erasure?
It is, yes. So we need to, thank you for clarifying that, because I kind of said that really fast. We need to continue documenting any differences that exist by race, as long as they exist. As long as race is pertinent in terms of how health is distributed, as housing is distributed, the criminal legal system acts on people, education, environments, all of this stuff. As long as there are differences by so-called race, we need to know about those differences so that we can get to the root causes of the differences, which are in racism, and dismantle that system. In California now, a few decades ago, there was an effort, so I'm not going to say the man's name because I can't remember it right now, but there was one of their proposals that the citizens can vote on was called CRECNO, Classification by Race, Ethnicity, National Origin, something like that, color or national origin. And it was an effort to have California stop collecting data by race, because the stance was that if you collect data by race, you're just creating racism. And that was a horrible thing. What we need to do is we need to collect data by race, but we need to understand what race measures and be extremely clear that race is not biology, and also that race is not ethnicity. So people who are called Black in this country could have been, raised in the rural South or urban North, or just immigrated from Haiti, or immigrated from Somalia, or immigrated from Nigeria, or actually just come from Australia, right? Aboriginal, and all be called Black in this nation without having any genetic similarities at all, except as all humans do, right? But not even coming from the same so-called geographic stocks, not having the same dietary patterns, not having the same languages or history or anything. So race is a huge thing which captures many, many different ethnicities. It does not capture genes at all. It is it's a substrate on which racism operates day to day. So as long as we're clear about that, then yes, we need to continue documenting race-associated differences, because we're trying to eliminate their root cause, racism.
Thank you. We do have another question, but I think you'll get to it. So we'll hold on to it for now.
Okay, thanks, because I can't remember how much more stuff I have, but I do have more stuff. Okay, so we're going to shift gears now. First of all, I'm going to say that that same definition of racism that I gave you can actually be generalized to be a definition of any system of structured inequity. So you could say, what is sexism? Well, that's a system of structuring opportunity and assigning value based on gender that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And so, you know, there are many axes of inequity operating in our society today, intersecting in communities and in individuals, which include, you know, race, gender, sexual orientation, you know, gender expression, religion. You know, I have a whole list of, you know, body weight, you know, all kinds of immigration status. You know, I have a list of about 15, 20, incarceration history, all of these things. All of these things are axes of inequity, right, that have their associated systems of structured inequity. All of these things are at least risk factors for how disease manifest, you know, disease occurs. Even as a smaller set are risk, I mean, they're risk markers for disease, they're risk markers for how opportunity is structured and value is assigned. Even a smaller group are actually risk factors in the progression of disease because of that differential distribution of resources and all. So what I say is, many people, as I've been talking, will be thinking, well, she's talking about race as the axis of inequity and racism as the system. Why isn't she talking about heterosexism? Why isn't she talking about, you know, sexism? Why isn't she talking about capitalism and all of these other things? I acknowledge that all of these systems of structured inequity have the same structure. The reason that I've focused my life's work on race as the axis of inequity and racism as the system is that racism is foundational in our nation's history, yet many people are in staunch denial of its continued existence and profoundly negative impacts on the health and well-being of our nation. So I honestly do believe that all of us in this nation need to at least be actively anti-racism. And you know, I never say anti-racist because that just lets people think you're against them or people. We're always anti-racism against the system. But I think all of us need to be actively anti-racism, even as we're engaging in these other struggles. And to the extent that we're able to dismantle the mechanisms of racism, the other struggles will benefit as well. So I didn't put in slides about that. I know I didn't, but I just wanted to say that because I recognize that people who are in all of these different struggles recognize the similarity. And so I just wanted to call it out. Now, this is my three-part definition of health equity. What is it? How do we get there? And how is it related to health disparities? And this definition, if you're familiar at all with the Healthy People 2020 definition, might seem a little similar. It is because I helped write the Healthy People 2020 definition. I haven't even looked at the Healthy People 2030 definition. I know we're already in 2021. I will. But anyway, I'll tell you how it differs from the other definition. First of all, what is health equity? I define health equity as assurance of the conditions for optimal health for all people. So Healthy People 2020 stated that health equity is attainment of the highest level of health for all people. And I agree that that is our goal. But what troubles me about that as a definition of health equity is, what if we hit that last Sunday miraculously? Are we done? And I don't think health equity is profitably thought about as an outcome. I think it's a process. Which process? Assurance, which is actually one of the three core functions of public health identified by the Institute of Medicine, along with assessment and policy development. Assurance of what? Of the conditions for optimal health. For whom? For all people. That's what makes it equity. How do we get there? Well, achieving health equity requires at least these three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. How is health equity related to health disparities? Health disparities will be eliminated when health equity is achieved. Health disparities are differences in the height and vigor of my pink and red flowers in the gardener's tale. Health equity is all that stuff that came before. And if you are wondering, am I about health equity? Is the work that I'm doing or the group with whom I'm working, are we about health equity? I would say you need to at least be doing these three things: valuing all individuals and populations equally. How do I know if I'm doing that? Well, think about how we might value our children or our nieces and nephews. We would protect them. We would invest in them. We would encourage them. We would invite their input. We could, in just 2 minutes, have 30 valuing terms. That's how you need to be treating all individuals and populations equally. How do we operationalize recognizing and rectifying historical injustices? Well, first of all, we need to learn the history of our organizations that we're working in, the histories of the block that we're on, of the city that we're in, our state, the nation, our world history. We need to understand history. We as a nation are pathetically ahistorical, right? So we need to read history, ask about history, and then we need to recognize and then rectify historical injustices. We have to stop pretending that the present is disconnected from the past and that the current distribution of advantage and disadvantage were just a happenstance. And then what is involved in providing resources according to need? Well, first of all, there's 2 stages in this. The first is that we need to agree as a group on a metric of need. So maybe the metric of need is the number of people dying from COVID-19 per 100,000 population in your group. Or maybe it's the infant mortality rate, or maybe it's whatever you want to pick, right? And then once we agree on that metric of need, the second part is the harder part, and that is maintaining political spine so that when you get some resources that you distribute them according to that metric of need. Because I tell you, if you're a health officer in a state with 5 counties and you get $1 million, the first reflex is to give every county $200,000. But you might need to have the political spine to say to County A, you won't get any this year because County E needs that more. And maybe you won't get any the next year or the year after. And that is where many people fall short. So now I'm going to shift into what I have described and recognized as, at first I described it as 7 societal barriers to achieving health equity. And then I described them as 7 cultural barriers in the US context to achieving health equity. And then I described them as the 7 values targets for anti-racism action, because racism structures opportunity and assigns value. And we know a lot of the structural targets in terms of the prisons and the housing and education and all of that. But these are the 7 values targets for anti-racism action. And the most recent time I was describing them in a kind of flowery way these are the 7 social delusions that undergird the intergenerational transmission of racism denial. Anyway, here they are, the seven barriers to achieving health equity. The first is that in this country, we are narrowly focused on the individual, which makes systems and structures either invisible or seemingly irrelevant. It makes our self-interest very narrowly defined. So if we don't even count our cousins and aunts and uncles as part of self, we're certainly not worried about the people on the other side of town. It limits our sense of interdependence. There, but for the grace of God, go I. We are all in this together. I am my brother's and my sister's keeper. And it also limits our sense of power. Because if we're thinking, well, what can I do about racism? That's the wrong question. We need to be thinking about collective efficacy, because collective action not only propels us and informs us and inspires us, it protects us. The second of these 7 barriers I just talked a little bit about, the fact that in this nation we are ahistorical. We act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. And when we are ahistorical, as we are as a nation, and then we are born and we see things a certain way, we think they've always been that way and always need to stay that way. So this ahistorical stance even limits our imagination to how to change things for the better in the future. And I also want to say one thing. I sort of skipped over the unfairly disadvantages and unfairly advantages impacts of racism in my definition. And I just want to tell you now, there are many people in this country who agree there are 2 states of being, but they would describe them as disadvantaged and normal. And the reason that many people think there are 2 states of being, disadvantaged and normal, is that we in this nation are ahistorical, and people do not recognize that their so-called normal is built up on a whole mountain of unfair advantage. The third of these 7 barriers to achieving health equity is in our endorsement of the myth of meritocracy. The story that goes something like this: if you work hard, you will make it. Now, I give you that most people who have made it have worked hard, although not everybody who's made it has worked hard. We've had some prominent examples of that. But yes, most people who have made it have worked hard, but there are many, many other people working just as hard or harder who will never make it because of an uneven playing field that has been structured and is being perpetuated by racism, sexism, heterosexism, and all of these systems of structured inequity. And when we deny those systems, when we deny racism, we are blaming those people for not making it because they're lazy or stupid. And I just want to say one more thing. There are many ways to deny racism. Some people find it popular these days to say racism doesn't exist. We heard that last night. I don't know if you listened to the response to the president's address. I mean, they just come on out and say there's US is not a racist country. There's racism doesn't exist. But the more insidious way that many people deny racism is to never say the word, even though those very same people might be talking and working on diversity, equity, inclusion, disparities, disproportionalities, belonging, cultural humility, cultural competence, structural competence, race, but working on all of those things and never saying the word racism. Because if we're working on all those things, but we still never say the word racism in our national context of widespread racism denial, we are complicit with that denial. The fourth, I'll go faster now. The fourth of these 7 barriers to achieving health equity is our endorsement of the myth of a zero-sum game. If you gain, I lose, which sets us up in competition with one another as opposed to cooperation. It masks the cost of inequity, that racism and these other systems of structured inequity are sapping the strength of the whole society. And it actually hinders efforts to grow the pie. In fact, it's sort of like I'm sitting at a potluck dinner. I see you coming. I don't want you anywhere near this table because I think you're just going to come and eat up all the food. I don't even value you. And I do not recognize that you are bringing with you all kinds of cakes and pies and roast and fruits and salads and all kinds of delicious food. The fifth of these 7 barriers to achieving health equity is our limited future orientation in this nation. So we're ahistorical and we also have a limited future orientation. Now, the parts of the future that each of us can touch today include the children and the planet, where hopefully both of those will survive us, right? They're parts of the future that are right here today with us, and we're going to pass on, and hopefully they'll still be here. We in this nation have a disregard for the children and a usurious relationship with the planet. In fact, in this country, there are American Indian nations that have a 7 generations approach to decision making. So they think when they're trying to make a decision, what's the impact 7 generations hence? What is the 100-year impact of this policy that we're considering? We do not, as a nation, have that kind of approach. Nor do we greet one another, like I'm told that the Maasai people in East Africa greet one another not by saying, hey, how you doing? But by asking the question, how are the children? And hoping to hear the answer back, all the children are well. We don't even ask how the children are in this country. And if we did, we certainly wouldn't get the response, all the children are well. The 6th of these 7 barriers to achieving health equity is our endorsement of the myth of American exceptionalism. Even look at how we say, what we're really talking about is the myth of US exceptionalism, but we call it American, right? We ignore Canada, Mexico, all the countries in Central and South America, and we call ourselves American. But anyway, this myth that the US is so special, so different, so ordained by God that the usual rules should not apply to us, that we are worthy and entitled to all of this vaccine that we have here right now, and that there's nothing that we can learn from other nations. If we had only paid a little bit of attention to how other nations were ably handling the COVID-19 pandemic last year, we could have saved hundreds of thousands of US lives. The 7th of these barriers to achieving health equity is white supremacist ideology. I've mentioned it a little bit before, but this is not a lightning rod term. This is the description of the false idea of a hierarchy of human valuation by race. There is no such hierarchy. And the false notion that there's a hierarchy and that would put white people at the top as the ideal or the norm. But this false idea, this white supremacist ideology, gives many people who are living as white a sense of entitlement. I won't say many, some, I don't know. I'm not going to characterize the number. It certainly results in the devaluation and dehumanization of people of color and fear at the browning of America that is underlying a lot of our political divide today. I want to, I'm almost closing up. I'm going to do this little section. Let me look at our time. Okay, so we have enough time and then we'll have time for a few more questions. All 7 of those barriers to achieving health equity play out. Certainly they undergird, as I said, the intergenerational transmission of racism denial, but they have also played out in our COVID-19 pandemic to actually hamper our response. And so as I saw the pandemic playing out from when I first became aware of it in March, when it was first declared a pandemic, throughout, I was keeping a list actually. The first time I said, oh, there goes the narrow focus on the individual affecting adversely how we're approaching testing. And then I was like, oh, and masking, and oh my goodness, how we're talking about school reopening. And there it goes again in terms of the clinical trial endpoints. And there it goes again in terms of our vaccine optimism. And really, it's showing up again in terms of our phasing of the vaccine rollout. And it's certainly showing up in terms of how we are understanding the COVID-19 death toll in this nation. So I just want to go a little deep. This is the edge of my work right now. So again, it's not shiny and pretty and smooth, but very interesting. So I'd love to have maybe questions or comments about this. With regard to testing, here's the background. In my analysis, I would say, in the last year, in 2020, the US treated COVID-19 as if it were a medical care issue, as opposed to a public health issue, as if it was an individual by individual medical care thing, as opposed to a pandemic affecting all of us. With regard to testing, the medical care approach to testing is about confirming individual diagnoses for those who are symptomatic or exposed. I mean, at the very beginning, if you'll remember, you had to be already in a hospital with pneumonia and they would just test you because of the limited number of tests to see if your pneumonia was COVID-19 pneumonia or not, to help people going into the room to know how they needed to gear up. But anyway, this medical care approach has continued to predominate in our testing. We have not taken a public health approach to testing. We have not been trying to estimate the amount of virus circulating in the population today by testing both symptomatic and asymptomatic persons. And why does this matter? Well, because of the time delay and the underestimate, the undercount in terms of understanding how much virus there is in our community today. Because if you're counting people who are symptomatic, the test positives, they don't become symptomatic for 7 to 10 days. That's a 7 to 10 day old Polaroid picture developing, right? And especially when we had exponential spread in this nation between November and say January of this year, if you have a 7 to 10 day delayed estimate of what's going on, that's 2 generations of exponential spread. You have already underestimated by on a scale of 4 from what the real amount of virus is in the population. If we look at hospitalizations, that's a 2 to 3 week delay before people are even hospitalized, and much less the reporting delay for hospitalizations. Deaths, a 3 to 5 week delay. Whereas probability surveys, population-based probability surveys, for example, testing both asymptomatic and symptomatic people would give us a real-time estimate of what's going on so that we could have a real-time response. What about with regard to masking? Well, the individual orientation is that we're wearing masks primarily to protect ourselves. The collective orientation is we're really wearing masks primarily to protect others. It is both, but it's actually more to protect others than to protect ourselves. Why does it matter about this individual versus collective orientation? I think we need mask mandates. I know the CDC just lightened up on the outside, and I think it's causing confusion. For myself, I'm going to continue to wear my mask everywhere when I'm outside my house, or people are inside my house and they're not from my family. But these mask mandates are essential, especially when we're trying to protect the health of the public in the face of individual objections, which continue to be there's no virus, or I don't feel vulnerable, or masks make you uncomfortable, or masks make you sick, or whatever the individual objections are that are not based in science. With regard to our school reopening discussions, the individual focus says, well, the kids don't seem to be getting that sick, although some of the kids are getting sick and kids of color are getting more sick than other kids, right? But the community focus is acknowledging the possibility that the children could be vectors and they could spread disease. Why does it matter if we have an individual or community focus? Well, we need to place safeguards against spread from schools into communities, especially as we're reopening schools. Now, I know the CDC based their move to reopen their kind of, first they're going to acknowledge the community prevalence in terms of reopening decisions, and they're trying to equip schools with good ventilation, and they're trying to do all of this. But there was a study that they based their thinking on that said that there wasn't much school out into community transmission. But I just heard something else. I learned something else, that in the UK, the reason they even understood there was a new variant, the B117, was because they were starting to see school to community transmission because of that variant, which is now becoming predominant variant in many places in the US. The vaccine trial endpoints, what do I mean by that? It means like, what were they testing for? How were they going to test whether the vaccines were good or not? Well, the individual focus was about symptomatic disease as the primary endpoint. Does this person, do they feel sick? Do they have to go to the hospital? Are they in the ICU? Do they die? The population focus would also say, while we're doing these trials, let's also try to understand something about asymptomatic viral infection, which they could have done just by swabbing the noses of people in the trials every week. It's not comfortable, but they agreed to be in a trial as an additional endpoint of interest. That was not an endpoint in the first trials that came out. Why does it matter? It's because asymptomatic spread is what is fueling the pandemic. Now we have a little bit more information, after the emergency use authorization and kind of post-authorization evaluations, that the immunizations are seeming to also decrease asymptomatic infections, but we really didn't know at the beginning. Vaccine optimism. Here's the backdrop. The virus has one job: to replicate itself, and it will infect any available vulnerable host. An individual focus is reflected in our focus on vaccines, which decreases vulnerability at the individual level of individual hosts. Our public health strategies, both at the individual level of masking, physical distancing, hand washing, avoiding indoor congregate settings, decreases the number of available hosts by hiding ourselves from the virus. Why does it matter, this focus on vaccines versus the focus on public health strategies? Why, when the vaccine became available, why isn't it great to just be all vaccine optimistic and not think about public health strategies? We need to continue to fully implement our public health strategies, both individual and at the governmental level, making it feasible for more people to safely and feasibly shelter at home in place, even as we roll out the highly anticipated vaccines. In terms of the vaccine rollout phases, we need to acknowledge two types of risk, which I describe as individual risk, which reflects increased vulnerability due to age or medical conditions, and structural risk, which reflects increased exposure at work or where we live. Why do we need to acknowledge both of these types of risk? Because vaccine allocation addressing structural risk is what is needed to address the disproportionate impact of COVID-19 on communities of color. The older, the population, the older population is disproportionately white because they're surviving, to those ages. Certainly, people of color do have more medical, the pre-existing medical conditions. This is what I want to say about this. Phase 1A, now phase 1A was just a recommendation. States did whatever they wanted to, but phase 1A was about getting the vaccine first to people who were at increased risk at work because they were medical care providers, or increased risk where they lived in nursing homes. But it recognized the structural risk aspect of it, but it was incomplete because healthcare providers, who are not the only people who are at increased risk because of work, increased exposure to work, because meatpacking plant workers, or people in warehouses, or people driving buses or stocking the shelves in grocery stores were also, and they were put into the phase 1B and then eclipsed in many states, including Georgia, where I live, where they made phase 1A plus, and they brought all the 65 plus in there ahead of those other essential, but I guess disposable workers, who are the younger people, right? And even when we talked about increased risk where you live in terms of nursing homes, it was described as increased risk in terms of long-term care facilities, but they only went to nursing homes, not prisons or jails or detention centers and the like. So anyway, if we still want to address the disproportionate impact of COVID-19 on communities of color, we need to understand the structural risk aspect of these things. And finally, the COVID-19 death toll. The individual focus acknowledges that those dying from COVID-19 represent private losses to loved ones. The collective focus also recognizes that those dying from COVID-19 represent shared losses to the whole society. Why does it matter? We all need to recognize and mourn our monumental collective loss as a nation. 572,000 souls lost and counting. That's true even for those who have not yet experienced the loss of a family member or a friend or a colleague or a patient due to COVID-19. So The key messages, I said, racism exists, racism is a system, racism saps the strength of the whole society, we can act to dismantle racism. I gave you the story on racism exists to a reality and cement dust in our lungs. I alluded to the levels of racism, Gartner's tale. I did not tell you life on a conveyor belt, which is about we can act. I want to just quickly share with you my 4-part national campaign against racism policy agenda, which includes reparations, criminal legal reform, massive investments in communities of color around housing and education and environmental cleanup and green space and wealth building and businesses and all of that, as well as massive investments around children, all children and their families, because we can't talk about your children and my children. All children are our children. We need massive investments around children and their families. I'm heartened by the child tax credit, which is going to eliminate 1/2 of child poverty. Let's go for the other half too, But anyway, so what can we do today? That's my big national agenda for National Campaign Against Racism. I didn't leave my national campaign against racism at the APHA door when I ended my presidency in November 2016. I actually think that all of us as a nation need to be engaging in this national campaign against racism with those 3 tasks of naming racism, asking how is racism operating here, and then organizing and strategizing to act. What can we do today? Going back to that image I gave at the beginning, we need to actively look for evidence of 2-sided signs. Is there something differential going on here by race or ethnicity or language or immigration status or zip code or urban, rural or religion or whatever, all of these axes of, of inequity that operate and divide us in our society today, that operate and divide access to opportunity and cause differential access to exposure to risk. And we need to look not only at outcomes, but at opportunity structures. When we're looking for evidence of 2-sided signs, we should not think, well, looks open to me. That is insufficient. We need to burst through our bubbles of experience to experience our common humanity. Very quickly, we all live in a bubble of experience. Some of the bubbles, our kids and their schools and our jobs and our community and religious affiliations, social affiliations. Some of the bubbles are quite big with thin soap bubble boundaries. Some of them are smaller with thicker plexiglass boundaries. And some of us are tinting our bubbles and some of them are polarizing our bubbles. But whatever kind of bubble we live in, most of us do not know that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We must create opportunities as organizations, as schools, as communities, as individuals to do bubble bursting so that we can experience our common humanity on the other side of town, experience that our common humanity in a different setting so we can start building common cause. We need to be interested in the stories of others, believe the stories of others, and then join in the stories of others. And I actually was quite heartened by the mobilizations of 2020 that seem to reflect that. But maybe we need to be believing the stories of others even without cell phone video documentation. We need to develop a sensitivity to seeing the absence of who is not at the table, what is not on the agenda, what policies are not in place that if put in place would get us to more fairness. We need to reveal inaction in the face of me because that's how structural racism very often manifests these days. But all the power is not just for those who are sitting inside the restaurant. Those of us on the outside need to know our power. We need to recognize that action is power. And especially, as I said, collective action is power. Collective action will restore us. So I'm so glad for this opportunity to share some of these thoughts. And I think we still have a few minutes left for other questions and discussion. Thank you.
Thank you so much, Dr. Jones. I will go ahead and add Ms. Torres and I to the spotlight so folks can see our face as we ask some questions.
I'm going to pull my hair over to you so you don't see all of this gray.
Sorry, for some reason my camera was being quite finicky. We're looking at, there's just so many amazing questions, and we are really grateful to have you here. And we're just, we really thought that this was a great cap off to our series and our talks. And so we're just, I guess we could ask, there are so many questions afterwards. Would you be able to try and answer some of them if we emailed them to you?
Maybe. I could try, but I'm always going. I'm always going. So I hardly, so I'm happy to try. I'm happy to try.
Perfect.
I'm also
Thank you.
happy to stay a little longer than exactly 8, although I know you close, that you make it private for the people in the class at 7 your time. But anyway, so I'm happy to stay on too.
Okay, that's great. I think our students love the questions time. So
Mhm.
students who are registered, we will give you further direction depending on what time we go until. And this is recorded, so if folks do have to hop off, you can play back the Q&A time if you need to do that. Yeah, as Ms. Torres said, there's so many great questions. I think one of the things that we're curious about that a few students asked relates to kind of your personal journey in being able to talk about these things. And so there's 2 questions that I think are related. Mona asks, how does a Black American person work in white environments with behaviors of denial, of knowledge, avoidance of their actions, and that person is afraid to speak out of fear of losing their employment? And then relatedly, a question wanted to know about your career and how did you find the support that you needed to engage in this needed but not mainstream work that is, we can see it's often criticized. So do you have any advice for students and professionals who are, seeking to do this action that you've talked about?
The advice right now, so we're actually in a better time where people are at least, some people are acknowledging that racism exists because it kind of slapped them upside the face, but it's not the first time it slapped them upside the face. And that's why I talk about if you just say a thing, you might fall back into racism denial. My advice is to find your flock. And when I say that, this is the image I have. So, you look up in the sky in the spring or in the fall and you see geese flying in a V formation, and they're flying in the V formation because the goose at the front is breaking the wind for those behind, who's breaking the wind for those behind. And as I would see those geese flying, I wondered what happens when the goose in the front gets tired? Because you don't want it to just drop to the ground or fly off someplace random. And geese don't do that. When the goose in the front is tired, she moves back and another goose takes her place in the front. So we all need to either create or identify our flock and then take turns in terms of leadership and in terms of speaking out and saying, excuse me, what you said was just like, or I don't go there. I say, excuse me, why did you just say that? That's what I ask. Why did you just do that? Why did you just, I give people the benefit of the doubt. So how do you find your flock? Maybe your flock's not even there, which talks about an inside-outside strategy. So you always have to be aware that your flock might not be right in your institution, but there are certainly people in the community who can become part of your flock. And if you're outside, you need to know people who are inside who know what's going on and have the policy-making powers. And if you're inside, you need to know people outside when you're trying to say something and do something and they're trying to kill you, who will have your back. But a real strategy that people have told me has worked is to take the 4-page paper that has the Gartner's tale in it. It's 2 pages front and back that I published in the American Journal of Public Health in 2000, 21 years ago. And go to your group, whoever it is that you're working with or around, your board, your colleagues, whatever, for their next lunch and learn or, whatever they're doing. And you say, let's all read this and discuss it. So that's one thing, that's nice. But you're listening to the discussion, not even for exactly what people say, but how they're talking about it and how engaged they are. Because you may find some unexpected compatriots. I don't like the word allies. That's too far. Because, if you're an ally, then you might say, well, I have to go on vacation for a month, check you in a month, hope the struggle goes well. So you might find some unexpected compatriots. Then after that lunch and learn or whatever, you go to them, you say, I really appreciated how you were talking about this. Have you noticed how such and such, and you start talking about how you're going to deal with the issues that you've been noticing, right? So that's one way to find your flock. And never cut yourself off from the community if you're inside. And if you're in the community, always recognize that institutions are not just solid walls. There are real people inside, and you can find some sympathetic people inside, and then you guys can do the inside-outside game. I don't know if I got both questions. Oh, somebody asked, how did I do it? That's a long story. We don't have time. But one thing I'll say is that I have been in places that once they kind of got a sense of what I was doing, maybe they weren't so happy with what I was doing, or, with a supportive. And I have made the decision that rather than constrain my work, which is my passion work, I would change location. So I don't change my work, I change location. So that's just a thing. Don't let people make you a zombie. And if you keep working out of your passion work, then you'll be doing your work to do.
I actually, wow. I'm quite speechless, even though I knew what I was going to say. But yeah, I definitely agree. And you definitely need to go where your work is needed, but also wanted and welcomed, and that it can sprout amazing things. And so we did have an interesting question that does relate to a lot of things we've talked about in this class. And it's how can a capitalist for-profit health system promote health equity? And I thought that was a really interesting question because there were some other questions you answered through your other question, but
right.
This was something, and you know, the type of healthcare system we have compared to our global neighbors, compared to even our neighbors in the North and the South. So
right. So that's a good question. I would say that to the extent that we can, within the constraints of what we have, always be about valuing all individuals and populations equally, recognizing and rectifying historical injustices and providing resources according to need. That's where we start. Those are the treads that we start on. But I recognize that, and I'm not a student of capitalism, Marxism, economics, or anything. My understanding of capitalism is that some people own the means of production and other people work there and make the profit, but don't enjoy the profit. So that's my very, rudimentary thing, and that is not good. That's not about equity. So I think that we have to think about how we distribute wealth and burden and opportunity and all of those things. And we need to value all individuals and populations equally. And if we acknowledge that a capitalist system is not valuing all individuals and populations equally, then we need to work in there too.
We had another question.
May I just say one more thing though? I want to say about this. This is, so now I'm there. I have been in rooms where people have tried to prioritize, should we deal with racism or capitalism, right? And I think that that is not a fruitful thing. Some people talk about racial or racialized capitalism as being foundation in a nation. I think that's an accurate description. But there are other economic systems, for example, where racism still prospers. You know what I'm saying? So capitalism doesn't trump racism in terms of what we need to address. And there have been people who have criticized me and my focus on racism and saying, well, you clearly don't care about poor white people. And I do. I care deeply about poor white people, poor Black people, poor Indigenous people, poor Latinx people, poor Asian people, poor Native Hawaiian, other Pacific Islander people, Indigenous people, all kinds of people. This is not an either or, anti-poverty or anti-capitalism. Those are two different things. Or anti-racism. It's not an either or, it is a both and. And what I say is that even if we figured out the magic wand to either eliminate poverty today, ding, I would do it, or a double ding would actually equalize income today, I would go all the way there. Even if we figured that out, if we did that without addressing the background structures, policies, practices, norms, and values, the mechanisms of structural racism, then even if we equalize income by race and across everything today, within one generation, we would start to see a stratification by race in terms of income. This is not an either or, anti-poverty or anti-racism, it is a both and. So I just want to be clear of that. And so I have actually chafed when people have wanted to not talk about racism because I think the whole thing is capitalism. I think that most people who have their eyes open are not saying those kinds of things, but there have been times when I've been in those kinds of rooms, right? And people who are talking about racism recognize that capitalism has used racism as a tool to separate, after the emancipation of enslaved people of African descent, to separate the white sharecroppers from the Black sharecroppers, or in the unions to separate white folks and don't want Black people in the union, and to separate us today, and to separate poor white people today from their own interest, politically and economically. So there is an interchanging there, but I think both of them have the same structure. They are systems of structuring opportunity and assigning value based on fill in the blank. So based on the relation to capital, or based on so-called race, or based on, if you go to gender and all of things, and they all have the same impacts of unfairly disadvantaging some, unfairly advantaging others, and sapping the strengths of the whole society through the waste of human resources. I think they are co-equal, having this same structure, as opposed to one trumping the other. And I keep using that word. Anyway. You know which word.
That was a great elaboration. I think this resonates with a lot of people in the chat. So I did have another question about your use of allegories. And earlier in this semester, we had a session about art as advocacy. We talked about dance, but I think of allegory and storytelling as another form of art that can be used to advocate. And one of our students had a question: as a creator of these captivating allegories, how would you feel if they were employed to speak to other systems of inequity, for example, ableism?
Yeah, I think it's right. Absolutely. Yes, that's the same thing that I'm talking about, that they have the same structure, that all of these systems of structured inequity have the same structure. So when I use an allegory on one thing, yes, it transposes or whatever. The other thing is, sometimes people ask, well, how do you make up these allegories? And honestly, it comes because in my essence, I'm a teacher. I even used to think, and it may be true, that my name, Camara, which my mother thought she made up, but it's a West African family name. Early on, I thought that Camara was a West African family name meaning teacher. I think that's not true anymore, but it was enough true for me because my essence is as a teacher. And so I just walk through the world noticing things. I'm very observant of things. And if I see something and I say, oh, that's unusual or odd, then I just store it away. And then if I'm trying to explain something to somebody, then I can pull on some of those images to help explain things. So the core of my use of allegory is because I am, in my essence, a teacher. And then I just notice things all the time in the world. So.
It's really inspirational. I think so much of the time we try to, especially in academia, we try to stick to this one format of understanding and seeing the world. And so I think it's really important for us to be branching out and really learning and talking and conceptualizing the way that we ourselves see the world, and not this very strict formula that this institution has created.
The other thing I want to say about allegory is that once I put an allegory out there, the question about could people use it for ableism and all, yes. Once I put the allegory out there, please credit me with the idea, but it becomes our story. And every time I tell a story, I'm learning more from the questions that come about it, or people sometimes give me little embellishments and all. And that's why I can't tell the Gardener's Tale in 10 minutes anymore, because now it's become 25 minutes, because I tried everything that I've learned from the Gardener's Tale over more than 20 years of telling it. I try to then transmit to the next group. So, so it becomes our story. And then we can all add to it, and we're all looking at it out here, and we can all learn from it, including me.
I actually think that's really amazing, because when you were talking about the restaurant, it actually made me think of something else, right? Like a restaurant isn't just about an open close, but there's sections of restaurants. So there's like a VIP section. There's like, so even within the open, right? Even within, like when you're talking about vaccines, even within those who have access to these vaccines to these rich countries, there are still areas, for instance, like quote unquote Indian country, right, that don't have that same access. So maybe they're eating at a poorer table with poor ventilation, and then you have richer people who are eating at a better table with better, you know. And so I was thinking about the depths of that when you were going into more depth about, actually, when you talk about more depth about the Gardener's Tale. And I was just like, yeah, there's so many levels that can be added to these allegories and kind of expand our understandings of things beyond just, okay, maybe it's not just open close, but it's like open for whom. Maybe sometimes it's open, sometimes it's not. And I really think that that would be great. So
thank you, Washika. That was great.
Yeah.
That was great, Washika.
But yeah, so we are, going to close this out. Thank you so much for staying so long with us. For our students, we do ask you to hang on a little bit more, hang on a couple of minutes, but we would like to again thank our really amazing presenter, Dr. Camara Jones, for being here, speaking with us in this recording, which should be available soon on the Epidemics of Injustice website with captions. So thank you again.
Thank you all. And should I stay on to be with the students, or I'm gone?
if you would like to.
I would love
I
to,
know it is late. We've been sitting for such a long time.
but I'm not trying to belabor anything. So you just tell me what I'm supposed to do.
You can stay on if you want. Some students have said, please, yes. So definitely, if you would like to, if you have the emotional energy to stay, that'd be great. But yeah, we're just gonna chat with the students really quickly and
Okay.
let them know different things for the last class. But yeah, we are so happy to have you here. This is amazing.
That's great. And as people are going off, I just want to say about what you were saying, Washika, and the open close sign. It's also that there are many signs around, and people only notice the most pertinent close sign to them, and they ignore all the open signs to them. You know, so in their lives, they're going to be, you know, none of us has. There are a few people at the very tippy top, white men, you know, cis, hetero, you know, rich, that probably may not see any closed signs, but all the others, and people tend to address the highest level of closed that they see, ignoring all the open that they see.
Yeah, I very much think that's true too. Yeah. But yeah, I honestly, I love the way allegories, I love allegories, by the way. I love allegories. I love little vignettes. I was an English major, so I think
Mhm.
stories really do have a great way of impacting people. And I do work in disability studies and disability justice. And a story is, I mean, statistics can tell you a lot, but pairing those with stories and allegories and help deepen people's understanding, especially people from different disciplines. So a lot of students in the class have different discipline backgrounds or they work in different areas. And I think that a story is so captivating for so many people.
It's how we used to learn as humans. We used to sit around fires and solve
Yeah,
problems through stories, through sharing
Yeah.
stories.
I've been thinking about that
absolutely.
too, and how we explain the world. And especially I do a lot of work looking at also like indigenous stuff in Canada. I was planning on moving there, long story I didn't. Um, and looking at like creation stories and how, you know,
Mm.
how do you explain the world around you? And how do you make sense of things, especially phenomena you may or may not understand yet. But I love that the stories don't stop, right? They don't say this is how it is, that's it, don't question it. It's always about this is that story, but think about it deeper, think, investigate it, have it walk with you. Um, yeah, if students want to turn on their videos, they can. So this second portion will not be